not crowd. If we want to buy mangoes, maybe we can line up one person at a time, giving each other a distance, all those measures. So the food markets, because people have to access food, people must have food. We don't want people to starve and die of starvation. So he allowed, because we must still have access to food, but also the markets have been advised that even when you are open, you must observe these SOPs. And should they fail to observe the SOPs, there is the risk that they will also be closed. So the population should understand that the closure of the prayer places is mainly a preventive measure. But also he said, if there is a wedding, you can have up to 20 people. But where do you get wedded from? You get wedded from a church. So it also means directly churches are not completely closed. If, for instance, I had scheduled to wed my spouse, I think we can still go to church, 20 people, and then go and have a function. So they are not completely closed in a way, but definitely when you go to our churches and mosques, the way people were praying now, they were breaking all the SOPs. You find the church is full, it is crowded, the people come without masks. So I think let's be responsible and know that the intention is to protect all of us, but not to despise God or to think that prayer places are not useful. They are, but for the next 42 days, we could live with this and then see how it goes.
How effective has been the National Community Engagement Strategy that was launched in October 2020? Because I think that was launched by government, and just want to know how effective it's been throughout the period from when it was launched to where we are now.
I think it has not been effective. It has not been implemented, if I can say, because in October when it was launched, those were the height of the campaigns, presidential, parliamentary, and therefore the focus was on elections and less on sensitization and mobilization for COVID prevention. And also when the cases started slowing down, cut us off the many measures which had been announced, there was relaxation in the public. You could even hardly hear talk shows or discussions on COVID-19 measures, the discussions on politics and the campaigns and so forth and so forth. So yes, the strategy was launched, but I think it was not effectively implemented. And when the COVID cases came down at the end of the year and the beginning of this year, there was now total relaxation in the public. It was as if we have defeated COVID-19. So I think the second wave now wakes us up that strategy must be implemented the later. The communication must now be robust. We must engage the communities in terms of informing them what's going on, the radios, the TVs, the print media, and all forms of communication must be upped in order for the population now to know what's going on.
Who has that strategy? Where is it?
Well, the Ministry of Health has been taking the lead on behalf of the government, but definitely many stakeholders, including civil society, private sector, have been part of this strategy, but the Ministry of Health has been taking the lead.
Okay. When the President was talking to us yesterday, he gave figures which I want to relate to here. And he talked about vaccination and said we've vaccinated 748,000 people so far.
Yes.
Of the 964,000 doses that we have.
Yes.
And he also was very emphatic for the people who have received the first dose to ensure that they actually get the second dose. Let me first talk about that, for example. What about if somebody gets one dose and they don't get another dose? Does it waste the first dose, or the first dose can still give me some lifeline as I keep going on and on, and I do not know? How about those? Because I'm thinking about some adamant Ugandans who might actually say, I received the first one, and so good to go.
Yes, the vaccine we are receiving, AstraZeneca and the others, require you to get 2 doses, the first dose and then the booster dose. That's when you can get adequate protection. So if you get only 1 dose, it gives you some protection, but it will not be enough.
Okay.
And that's why the President was emphasizing that if we have few doses remaining, it would be better
to concentrate.
to concentrate on those who have already received the first dose, so they get the second dose, and you know they are well and fully protected. So at the next doses which come, we embark on those who are starting the vaccination. So getting one dose, yes, it gives you some protection, but it will not be enough. And also the other challenge is that you may have received AstraZeneca first dose, then maybe now in the next batch of vaccines which come is Johnson & Johnson or Sinovac. You may start all over again because you can't get a second dose of a different vaccine. You may have to start all over again. So there will be that kind of wastage. So it is important that once you start a particular vaccine, you get the booster dose in order for you to have full protection.
Well, discussing doses or the vaccines here, Dr. Bariomus, I think we need to hear from you, the experts. A country like Israel has actually said that to go to their country, I think you have to be vaccinated by, you have to have a Pfizer vaccine. I think that's for Israel. And I'm thinking about people who would want to travel to Israel, where specifically that's what they want. China, I think, also has their own vaccine. And I'm only thinking, I don't know whether they've said that. I don't know whether it's their policy yet. But what about if China says, to come to China, you have to have been vaccinated by this particular vaccine? And I have received AstraZeneca from Oxford. What happens in that regard? Because there are quite a number of those, and we as a country are moving with AstraZeneca now, which is actually available. There's no other alternative in there. And I'm thinking, what about if I've had the doses of AstraZeneca and I am limited now to movement into a country that does not believe in AstraZeneca? What will happen in that regard? We need to hear from you and maybe WHO.
I think that's a bad policy, if at all they have adopted that. What I know, Israel is one of the countries which have vaccinated over 60% of its population,
yes.
And it has now brought down the infections. There are lots of politics regarding these vaccines, because right now we have many, like we have Pfizer, a number of countries that have strong health systems are using that. Pfizer, Moderna, we have J&J, we have AstraZeneca, which we're using here. You have Sinovac or CoronaVac from China. There's another one from Russia, and so forth. And all these vaccines have been accepted by all those agencies which must approve these vaccines. So for a country to insist that to access or to enter it, you must have used a particular vaccine.
It will be bad policy.
From a public health point of view, is wrong. As long as the vaccine has been approved by those technical agencies, including WHO, they should suffice. Because if I have received AstraZeneca,
I can't get another.
I cannot now start on another vaccine.
Because I want to go to country X.
Because by the time these vaccines are allowed on the market, they go through procedural processes of clinical trials, authorization by the same bodies. And the WHO finally says, yes, we can use this. So if a vaccine has been authorized by WHO, for instance, then it's as good as the other. And we do not, from a public health point of view, encourage this competition between vaccines. But sometimes it is just the politics of the agencies, because you see that AstraZeneca is a company, Pfizer is a company. They are named after the companies which have manufactured this. So sometimes there is politics behind this, but from
the public health point of view,
the other vaccine is as good as the other. The reason why we use AstraZeneca here in Uganda is that it is cheaper and affordable, because the other vaccines like Pfizer and Moderna require high-level refrigeration, supercooling, at temperatures of negative 70 degrees Celsius. We would have to overhaul our cold chain system in Uganda if we were to use that vaccine. And for developing countries like in Africa, it is not suitable. Whereas AstraZeneca uses the normal refrigeration
that we have.
And also, when the company made this vaccine, it made it cheap. It said they're not going to do any profit making. They want all countries to access. So it is more affordable compared to the others. But in terms of efficacy and safety, it's as good as the other ones. So there is no point that if I have used AstraZeneca I should not go to Israel, I should not go to China, I should not go to Russia or America. Unless if those countries are just marketing their own vaccine. So if China, for instance, insists that you must use the Sinovac, maybe it's a way of marketing their vaccine. But from the health point of view, it does not make any sense.
Okay.
Because I cannot be on AstraZeneca. Then if I want to go to China, start Sinovac. If I want to go to Israel, I go to Pfizer. You cannot get all those vaccines at one individual. You should get only one. So
Before we got into the second wave of COVID-19, the president spoke to us, and when he was talking about this vaccine, he actually said if we vaccinated those who are 60 and above and those who have underlying comorbidities,
yes,
and raise at the tune of about 4 million Ugandans, then would be good to go in as far as opening up the country to full scale as it would be. Now, just before we got there, then we now have the second wave coming on here. And the challenge here is that now it is actually not only those with underlying comorbidities, and it's not only those who are 60 and above. We saw yesterday from the graphs that the president showed to us that the ages of 20 to 39, now these are the working ages, these are school-going ages, these are the marrying ages, these are anything that you want to talk about. It's a fulcrum of virtually the entire economy or system that we talk about here. And looking at our statistics, we are talking about less than 1 million Ugandans who have received the vaccine in full doses. And we even do not have a million doses of these vaccines. The president said, yes, we're getting some, about 300,000 from China, and of course also buying from the others that are available on the market from Russia, from the US, and other things. When do we think that we can raise up to about 60 to 70% of Ugandans being vaccinated, which is about 28, 29 million Ugandans? And we're going to stay like this for a very long time until we raise those big numbers of people vaccinated.
Well, when the president made those statements, I think he was looking at the high-risk clusters of the population.
At that time.
The aged, the elderly, those with the comorbidities, those at high risk, and so forth. But the epidemiology of the virus is changing, like you have said. With the coming in of the new variants, you see now there is a shift that the children and young people are now also at a higher risk. For instance, you notice that when these vaccines were being tried and tested and eventually manufactured, they looked at those who are above 18 because the original strain of the virus was getting those who are old. So you find even the vaccine trials didn't focus on children. And that's why we're not vaccinating people who are below 18 years. But now with the changing face of the virus affecting young people and children and so forth, those statements have to be modified. The proportion of those who needed to be vaccinated in order for us to contain the virus have also to change.
Exactly.
And therefore, the figures have to be adjusted because of this new situation. Yes, shall we be able to get all those doses of vaccines? Of course, it requires money. We have to allocate more resources, but also I think increasing the many vaccines are getting on board, and hopefully as more companies and more manufacturers and countries give us vaccines, maybe they will become cheaper and more affordable. And therefore, the future is not very bleak, because you know, even in Uganda, the scientists are working out a vaccine.
Exactly, I was actually coming to ask
if, for instance, to become successful.
Professor Nantuli and the team, how far have they gotten with that, with the PRESIDE team?
So, what I'm saying, the vaccines, the variety of vaccines is getting more and more, and hopefully the vaccines will be getting cheaper and more affordable. And as we allocate more resources as government, we should be able to get many more doses for Ugandans. So I am not worried. I think we shall reach there and provide vaccination for majority of Ugandans. We shall also support the team, Professor Nantulia and his team, who are doing a very good job. I think they are almost halfway in the process of coming up with the vaccine. Hopefully when they do the clinical trials, then they will be successful, because you know it's a process. You start with developing a candidate vaccine, you try it on animal models, If it succeeds, then you shift to human beings. You do clinical trials in different phases. And if you are satisfied that there is a safety and efficacy, then you apply for authorization. And I think they're like halfway. And so far, I think so good. There are no major setbacks realized by the team.
Okay.
So far, yes.
Doctor, what explains the second wave? Because we had the president speak to us and he said that these variants coming from India, he called it B something 1, then there's a variant B11, I think 7 from the UK, then there's B135 something from South Africa,
Yes.
And all those others. Now, before we went into elections last year, Uganda, just like all the other countries on the continent of Africa, there are about 24, 25 countries on the continent of Africa, that had to go through an election or through elections during the year of 2020. Now, vividly, the countries that we remember that started in at the height of COVID, the lockdowns were countries like Burundi in May, and of course subsequently all the other countries until much earlier this year when we also went into an election. You, the scientists, were of course telling us that when you go through an election, of course, we had seen that all countries that had an election, of course, had that rise in the cases.
Oh, yes.
Is that what explains the surge now in Uganda that we went through the election? Was it supposed to happen immediately, or it even happens much later? We just want to know. If we hadn't gotten into that election in November, December, January, would we be where we are today? Had we postponed the election like some stakeholders were actually demanding that we postpone the election for 3 years, solve these things, put the economy right, put things right, then think about the election much time later. Had we forfeited, had we postponed the election, would we be where we are now?
I think elections may have contributed, but they are not the sole explanation of why we have the second wave. There was that debate whether we should hold elections or postpone, and there were those who were pro and against. But eventually we settled for having elections, but with the strict observance of SOPs. Although, of course, some players did not take heed and defiantly refused to adhere to the SOPs, held huge rallies. You recall when even one of the presidential candidates was saying, don't even put on a mask. He was not putting on a mask, having huge rallies. He was arrested and so forth. I think that failure to observe the SOPs in a number of areas contributed to the spread of COVID-19. But that was not the only reason. I think even if we had postponed elections and continued the behaviors which we exhibited, still would have got the second wave. Because like when we lifted most of the measures, the president and the government left it upon Ugandans to self-discipline themselves. For instance, we opened the schools and said, let the schools, the candidate classes, go back to school on the condition that there is now adequate spacing, social distancing, and the administration will be quite strict with the observance of the SOPs. But I don't think that strictness which was expected was observed. We said, yes, markets can get back, shopping malls, arcades can get back, but strictly observe the SOPs. But they did not. They did not. So all that misbehavior on our part as actors, I think, contributed. Maybe there was also complacency on our side as a government. We thought and hoped that the people had learned a lesson, that they would discipline and police themselves, which they didn't. So that was, I think, the major really problem. Then again, when we allowed international travel, we opened the airports and the border points, maybe there wasn't strictness observed. People who were coming in, that's how those variants or those strains have come into the country. Yes, I know they would require you to test within 72 hours before you fly out, but also before you come in, you test. Within 72 hours, you must provide a negative PCR test. But maybe that was not adequate. I was in Malaysia in April.
April this year?
Yes, April this year. I had my test ready.
Your PCR?
It's negative. I was allowed to fly out. Reaching there, they had to test me again and quarantine me They quarantined me. For me, they gave me 7 days. But they even put a tag on me and followed me every day. I was not allowed to mix with the public, even when my results had been negative. And after the 7 days, they had to test me again and confirm that I'm negative before they could allow me. And still some surveillance until when I left the country. And to enter any public place, whether shopping mall or any public space, there is a thermometer. For them, they also have some technology which is in your phone, where they have to check your status, whether you are under quarantine or being surveyed and so forth. They take your temperature, you must sanitize. So they are very strict. Everybody has to be accountable. But for us here, like when we open the airports, people come in, whether the results have been forged or not. Someone says, I was tested, I'm negative. Okay, they allow you into the country. And I think there was a weakness. We should have... Because
you have about 186 cases from the airport.
We should have, yes, demanded for a negative PCR test, but also we quarantine you at your own cost. Like the way they did it to me in Malaysia. I had to be quarantined at my own cost. My own cost, yes. The only difference there is because I was a VIP, they said get a hotel of your choice, not into the government quarantine center. And I went there, but I was under strict surveillance. They couldn't move out of that hotel. So here I think there was some relaxation. When we opened our airports and border points, we should still have subjected whoever is coming into the country some level of quarantining to satisfy ourselves that this person, because you could have tested in Dubai and you acquire the virus on the plane as you land. So the negative result which you did in 72 hours may not be enough.
Okay.
You may acquire the virus through the airport, through the plane, so we should have put a mechanism to quarantine them for some days and satisfy ourselves.
Very important. Now, in April last year, when we first went into that first lockdown, on the 1st of April, subsequently, we had a scientific modeling that you, the scientists, have and or had, and you projected to us through that model that if we do not lock the country by, I think, the end of April, we would have had 18,000 cases cumulatively, and 3% of those would have died. That's about 600 people. And so we went into a lockdown because there was a scientific modeling. Towards the end of the year, when we're going through, when we're now getting to December, of course, there were some cases there. Around December, we had actually a rise in cases there. And you still, the scientists, I remember, and I'll quote Dr. Wanyenze, who actually say that there was still another model, that if Ugandans put on masks rightly, and emphasized, observed these SOPs, then we'll still manage the pandemic. But if we do not do that, then we'll get a problem. Are we still informed by any particular modeling for this particular partial lockdown that we have, or it is just because we've all agreed that there's a problem, so the way to go is close here to curtail its spread? Do we have a specific model that we are following for this?
Yes, all these measures which are being announced are evidence-based. The president doesn't just wake up and say, close schools, put on this. So the scientists are doing their work. They are doing all this modeling, and you look at different scenarios. If we enforced wearing of masks religiously, how would the situation be like? If social distancing and other SOPs were observed all over the country, and the curfew observed, you do all those scenarios. So the scientists, yes, are still doing the modeling, and the scientific assessments which are informing all these measures. So the measures that the government is announcing are informed by science, that I can say, yes.
Okay, very important. Now let's get to what the president was talking about yesterday.
But the critical point is enforcement and implementation of all these measures. You can do modeling and show where you can go, but if there is a breakdown in enforcement, then that's where the challenge would be.
Okay. Yes. So if we adhere to the SOPs and did the best things, we think that this will actually come down?
Absolutely.
Absolutely.
Absolutely. Adherence to the SOPs, compliance with all these measures, but also vaccinating many more Ugandans. Because now that we have vaccines, we should be able to do better than even in the past, because when we did the lockdown and those measures, the vaccines were not yet in the market. But now, a combination of compliance to these measures plus massive vaccination should be able to give us better results than what we had even in the past.
Many people think that when the president decided to close the schools and to ask our children to come back home, it's also going to cause us a problem, because according to the statistics available there, the president revealed to us that over 900 we have over 900 cases in schools, and this is in about I think 40 districts of the country. And so allowing them to come home, and we are allowing our children to come home again with a problem. Now, where the judges are, the co-judges and all these other people, wouldn't we manage them from schools than allowing them to come home?
There was a debate over that issue. Yes, there is that risk that somebody carries the problem to a home where there has been
where it's been safe
COVID.
Where there's been
but
no
I
COVID.
think on the balance of all those, it is easier and less riskier to have this child in a home. If the child develops symptoms, or if they have already tested the child, it can be managed at home than leaving these children in a concentrated camp called the school. I think if you leave these infected children in a school, the virus can easily saturate easily and wipe out the whole school, the entire school. Wipe out in the sense of infection, not necessarily killing all of them, but infecting everybody in the school. So I think it is safer to take this case in the home. If they correctly identify the person as being positive, it can be managed there than leaving this child to infect the entire school. So they weigh probabilities, and I think it is safer that way than leaving them in schools. Because the nature of settlement within the school, there is overcrowding. And if SOPs are not being observed properly, the leadership and management is not isolating those who are getting infected. You can easily infect the whole school, and that can be a crisis.
There was a case, I think, in Brazil where a woman contracted COVID. She survived the first wave. Then when she got this other COVID again, it actually took her. She had to succumb to it. The questions out there are, we talk about herd immunity, for example, that if you vaccinate, which is a very good thing, that you give the bodies immunity to fight against the virus, or subjecting the population to infections such that they can also build herd immunity. What are the chances that when you contract COVID-19 and you recover, there will be no chance that it will get to you again? Or it's like malaria. You get malaria now, you treat it next month, you are complacent, you again get malaria.
This is an area which is still understudied. Like I said, COVID-19 is a new disease. And therefore, the scientists and researchers are still studying how long this immunity which you acquire from the infection itself or from vaccination, how long it can go. There are some studies which have put at 6 months, others towards 1 year. But vaccination gives you protection. And even when you get infected, you develop antibodies. So what we say is that when you get vaccinated, it is rare to get infected, but it is possible. It is possible, but very rare in a few cases. But there are also studies which have been done. You know, coronavirus, we are now discussing COVID-19, which is caused by SARS-CoV-2. But there is SARS-CoV-1. The one which caused the severe acute respiratory syndrome, and it was a problem in 2003. And
SARS, I remember we had a disease called SARS.
SARS, yes, exactly, 2003. And genetically, it has similarities with this coronavirus, because these are coronaviruses. There was that SARS of 2003. There was another one called the one which caused the Middle East respiratory syndrome, MERS, in 2013. All these are coronaviruses. Now, they took blood of those who suffered from SARS of 2003 in 2017. and found that the antibodies which had been formed in 2003 were still active and protective.
15 years later.
15 years later. So there is an assumption that even this coronavirus, the immunity which you mount towards either the virus or the vaccination can go that long. So there are publications I have looked at. So it's the ongoing assessment to see how long this immunity can last. But the general statement really that vaccination is very important, particularly against moderate, severe, and critical disease. Even when in rare situations, when you may get infected, it remains asymptomatic or mild. Even the trials which were done for these vaccines, for instance, whether it is Pfizer, Moderna, AstraZeneca, there were no cases of those who contracted the disease and became severe or critical. Because you know, when they are doing these vaccine trials, they do what they call double blind. There are people who receive the candidate vaccine, then there are those who receive what we call a placebo, something different, which is not the vaccine. And then they look at, do those who have vaccine, are they getting a disease? How about those who are not getting the vaccine, they get a placebo? And then they compare. That's how they measure the efficacy and so on and so forth. But it was very clear that these vaccines protect you against severe and critical disease. Therefore, you are unlikely to die of corona when you are vaccinated. Even in rare situations where you may get infected, the infection will either remain asymptomatic or very mild and it goes. You will not get hospitalized like what we see in intensive care. That's why we advise that, yes, we say still put on a mask, social distance, even when you are vaccinated, but most importantly, you protect yourself against severe and critical disease.
Yes. Now let's talk about another very important thing, and this is called testing, Dr. Baryomunsi.
Yes.
You notice that one of the ways we've actually managed the HIV/AIDS pandemic or epidemic is because testing can be done. Testing is done everywhere.
Yes.
Somebody moves out of the office, they go to a clinic, they go to any facility anywhere, and they can tell shortly thereafter that I'm HIV negative or positive. That they can do. For all mothers who go for antenatal, it's something that they do. You're pregnant, and for them to ensure that they manage the EMCTC is something is done, and they know. Now, because we do not have enough testing equipment or facility for COVID-19, look at a scenario where Dr. Chris Baryomunsi walks in the village in Kanungo and is going to vaccinate. Now, he does not know whether he has COVID or not, but just assuming he already contracted the virus itself, he is already COVID positive, but because he has not tested, nobody knows, and he is asymptomatic, and he goes for the vaccine. Does it help in any way, or what happens in that regard? Because I know that there are people now who rush to go for vaccination, whatever it is, because it's free, it's gratis. But yet again, when they are maybe positive but asymptomatic, what happens, and what plan does the government have in as far as testing is concerned to ensure that testing is available everywhere, that somebody can actually be able to tell? We are discussing what we're discussing, and we're looking at our cases because this is what we can afford to test. That's how we can be able to tell that we have so many cases. For example, yesterday when the president was speaking to us, talking about 1,200, the highest in a day. It's because we could test 7,000 to be able to get 1,200, the 17% who are positive for COVID-19. How do we manage this and do the correlation?
Yes, in the testing for HIV, we do what we call antibody tests. We test for antibodies.
The ELISA test or something? It's called ELISA or something? Or that's another one?
That's another one. ELISA is also like PCR, which we use for this one. So those ones are much easier. And what they detect is whether you have ever been exposed to HIV. And the technology is much simpler. That's why you can even buy some sticks from a pharmacy and test yourself, so it is much simpler. Now, even for COVID-19, we can do those rapid tests. but they are not good enough at the diagnosis.
Okay.
Even if you go to Cavalry region, the other day I was in Cavalry and did the rapid test, I was negative. In 20 minutes I had the results. But the mainstay of diagnosing COVID-19 or the coronavirus is using what we call PCR, which is a little bit sophisticated. At the moment, we are not able to do it in lower level health facilities, and it's still a challenge. That's why even when they take samples from you in Kabale, in Arua, they send them to Entebbe. But progressively, I think we're going to build the capacity and be able to do the testing in the countryside. PCR, I don't want to go too much into the science, that is the one which detects presence of a virus, because they check for what they call RNA, ribonucleic acid, which is the genetic material of this virus. So it's a sophisticated kind of procedure which cannot easily be done by our ordinary people in the countryside, but that capacity is being built over time. So your VRI and sister agencies are the ones who can do this for now, but the capacity is being built. There are machines which are called gene experts, which I think through Ministry of Health, they are now available, which are going to be distributed in different regional referral hospitals. So within the coming months and years, I think the capacity will be built first in the regional referral hospitals, down the districts, so that the testing can be done in as many places as possible.
How about receiving a jab and you're positive?
Yes, receiving a jab and you're positive, yes. When you get infected, you get some level of immunity. But the science is that when you get, even now, even when you have gone through COVID-19, we still recommend that you should get immunization, because the vaccination will strengthen, will boost the immunity which you have got from the disease itself. That's why we're saying, even if you have gone through COVID, still get the vaccination. The vaccination will supplement. In other words, somebody who has gone through COVID-19, yes, has some immunity. If you get vaccination, you get stronger immunity than somebody who has just gone through the disease. So, and there is no harm which is caused.
There is no harm?
No harm, yes. So whether you have tested positive or not, you are eligible for vaccination.
How has it been faring? We've not heard of many cases, like when vaccinations had just started, we had of clouds in the US, we had of all these things happening. Denmark has stopped it because of clouds, Russia has done this has done that, and there was a talk. I want us to know, over the 748,676 Ugandans who have received that vaccine, what stories have you had from those who have received it, apart from the disruptions that people get individually, but we want to look at those other side effects that may be very adverse to somebody after the vaccine itself?
Yes, there was that talk of clots, blood clots, especially in Europe, and some European countries started crossing the immunization exercise, and mainly because they're using AstraZeneca. For us, from the scientific point of view, we looked at it, and like in Europe, the incidence of blood clots in the general population was still much higher than in the population which had vaccinated using AstraZeneca. I think it was more of the politics than the science.
Okay.
Because there is a body in the European Union which approves drugs and medicines and related supplies. And they had that, the European Medicines Agency, EMA. Working with the WHO, they had approved AstraZeneca. But you see, when you look at the politics of Europe, is that AstraZeneca is a company, a multi-country company, but it worked with Oxford University, but AstraZeneca is based in the UK. Now, UK had withdrawn from European Union. You remember the debate on Brexit?
The Brexit.
So I think it was more of the politics, the European countries trying to punish UK, because AstraZeneca, Oxford is a UK kind of
punishing them for the exit from the
because there was no sufficient evidence to show that among those who had been vaccinated, there were more blood clots occurring.
Okay.
In situations where there were blood clots, they just happened coincidentally.
Okay.
You see, like, you might vaccinate me, and maybe I had diabetes or I had blood pressure, and I die of blood pressure. Correlation and causation are different issues. So I might die despite of, not because of.
Okay.
So the blood clots which were being observed could not be linked through a causality relationship with the vaccination, because, like I've said, the incidence of blood clots in the European population was higher than in the vaccinated population. And the UK was actually having the highest number of vaccinated people with AstraZeneca, and those situations of blood clots were not being seen.
Okay.
So the few isolated cases were being linked to AstraZeneca, but there was no sufficient evidence. That's why even when countries were withdrawing, the European Medicines Agency, which is a technical body for European Union, and WHO insisted and said, no, we are not recommending stoppage of vaccination because there is no scientific proof. So it was like more of politics,
a political thing
than science. Now
Okay.
here, all the people who have been vaccinated are being followed because these are new vaccines. Yes, we know the safety data from the clinical trials, but also it is important that we get operational data.
Okay.
As you vaccinate people, you follow them up.
Okay.
I think there have not been any significant incidences with the vaccine. We've not seen anybody dying because of the vaccine, anybody getting significant blood clots. I think the side effects which people get are the usual ones. Like when I received my first dose, I was feeling uncomfortable, and some mild
for a few
joint
days.
pains and so for a few days, and they just went off within 24, 48 hours.
Okay.
When I received my next jab, the second one, there was nothing.
Very normal.
And I think majority of the people receiving these vaccines
are carrying on.
Thank
you so much, Dr. Baryomunsi.
Because the question would be, if the blood clots were a significant problem, why was it in Europe and not here?
Okay, why was it there not here?
Not here.
Because 700, we've not had any. Your final statement, just to the public. What do you want the public, just final to the public before I get out of studios, because our time is up.
Yes, my final statement is that we are witnessing the second wave, which is much more serious than the first one. All the measures which are being announced by the president, by the government, are in a good faith. They are intended to protect all of us. Let's not wait for government enforcement agencies to come and crack the whip. I think we should be the enforcement agencies ourselves. Like, I'm happy to hear that some border riders are enforcing these measures. If their colleague carries two people, they say, no, the president announced you can only carry maximum one person.
And with a mask.
And with a mask. Get away, get off. If you have no mask, if the passenger has no mask.
So if the borders do that,
absolutely.
and the people in the markets do the same, taxis do the same, then we'll get better.
Then we should be able to contain this virus. As government also looks for resources to procure many more vaccines, so that we vaccinate as many people as possible, we shall be able to overcome this virus. Like the president said, this virus is easy to defeat if all of us remain committed and observe all these measures.
I want to thank you so much, Dr. Chris Baryomunsi, for having allowed to join us here, and we stop our discussion here this morning. Let's ensure that we do the best that we can do. For God and my country, stay blessed. Good morning and bye-bye.
Thank you very much.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
What does it mean to be closer together? It's taking the last bus home for a surprise visit. Closer together is strangers finding a connection. It's bringing home something much more than a box. It's the warmth of home. or the beginning of something new. There's magic in sharing the things that we love, because it's those things that bring us close together.
Prosper with Airtel Money today. Agent application and registration is free of charge. All you need to submit as a sole proprietor business is a letter from the business owner requesting for a SIM card and the purpose of the SIM card. Certified copy of Certificate of Registration of the Business issued by URSB. Certified copy of Statement of Particulars of the registered business and supporting statutory declaration in verification of the particulars. Copy of valid trading license. Copy of operational license issued by the relevant regulatory authority. Copy of TIN certificate issued by URA. Valid national ID for Ugandan proprietor or passport for foreign national, including a valid immigration entry permit, work permit, visa, or residence certificate. Colored passport size photograph of the proprietor and handler of the business. Proof of current physical address of the business, tenancy agreement, or utility bill in the name of the proprietor or landlord, or LC1 introduction